even when someone seeks out medical care, it's a complex combination of people and services and timing and appointments and durable medical equipment, and even trying to figure out what's the value of a particular visit. There's so many moving parts in that, whether it's a hospital or a clinic or whatever it is. It's just that, combined with the complexity of paying for it and the complexity of health, just makes it really difficult. And it can make it difficult to sort of understand, what are the components that we're assessing the value of, and can we split them out, and can we actually determine how much is due to the clinician and how much is due to the medication, and how much, so it just makes it that much harder to attribute certain components to the value that you want to assess.
Yeah, especially because a lot of these systems, like the reimbursement structures, even the ones that are value based, right, they are standardized by necessity because of scale. But there's a difference, right? Like a new graduate clinician that's just graduated a week ago versus maybe like the cardiothoracic surgeon who's been doing this for 20 years, arguably, or not even arguably, you could say, well, this guy's opinion that's been doing this for 20 years is probably worth more than this new grad, right? Mm-hmm. So how do you, loop that into some kind of payment structure if you wanted to? It becomes super, super complex.
Yeah, I mean, and even sort of broader than that, sort of philosophically, when we talk about health, we can talk about healthcare delivery, like the delivery of treating patients, and we can talk about population health, right? And we can talk about how healthy you are in maintaining your health. And in some ways, we think of those as different things, and they are, but they're interrelated, right? And so one of the things that, and this leaks into some of the other of those three components, but population health, we think of as sort of a societal responsibility and a personal responsibility. And yet with value-based payment, a lot of times we're sort of asking clinicians and hospitals who treat at the care delivery point of care to think about things like, well, what's going to happen to them in 30 days? How are they going to maintain their health? How are they going to stay healthy and stay out of the hospital? And those really are population health questions. So we've even sort of made it even more complex through some of these reimbursement policies, like you say.
Yeah.